All right. Hi, everybody. Welcome to another episode of Princess on the Pod. I am your host, and today we have our first guest that I'm super excited about. So we have Dr. Stephen Roth. Stephen is a board certified oral and maxillofacial pathologist. He practices clinical and histologic oral pathology at the University of Maryland. He earned his doctorate from the Ohio State University and completed his residency at Northwell Health Long Island Jewish Medical Center, where he started his career. Previously, he was adjunct course director at Touro College of Dental Medicine, and he also shares his educational pathology content on Instagram and YouTube. So without further ado, my first guest, Dr. Stephen Roth.
I didn't realize I was your first guest. That's
You're my
a
first
big
guest.
honor. That's a huge honor.
Oops, don't touch the lavalier. You're my first guest. Thank you.
That's a huge honor. Thank you.
Yeah. Did you ever watch Laguna Beach growing up?
So, interesting story. I have family that live in Laguna Niguel, and they lived in the same allotment as the villain. I forget her name, but the one that they made out to be the villain.
Yeah.
And it was interesting because my cousin went for a run and shared the story that she saw this person put groceries in and out of the trunk over and over and over again because they were
Oh,
shooting it over and over and over again. Just a glimpse into reality TV. But I watched a few episodes on MTV
I
back in the day, but that was a funny story.
I loved Kristen. Like they painted her to be a mean girl, but her boyfriend, her like high school sweetheart, his
Oh,
name was
Steven.
Steven. So every time, like, because you and I chat a lot, so in my head I'm always like, Steven.
I have a childhood friend that does the same thing. It's gonna haunt me forever. The show's been off the air for like 20 years and it's gonna haunt me forever.
I know. They're doing a podcast like recap of all the videos or shows too.
Yeah.
So yeah, tell us a little bit about yourself. Aside from the intro, where you're living now, what you're up to, and let's jump right in.
So, a Midwest guy. I grew up in the Midwest from a big Buckeye family. So, I'm a fourth generation Buckeye. Very interesting. My great grandfather graduated from Ohio State on May 7th, 1917,
Mm-hmm.
and I got my DDS on May 7th, 2017, 100 years to the day of my
Wow.
great grandfather graduated. So that's cool. I went undergrad there and dental school, and then after dental school, I knew second year of dental school that I didn't general dentistry was not what I was going to be good at and what I wanted to do. So I found oral pathology, and I was kind of torn between staying at Ohio State, which is a great program, or kind of venturing out and exploring something new, and ultimately decided that I personally was ready for a change. I needed to get out and kind of spread my wings a little bit, and went to New York where I trained and then was very fortunate enough to be hired on. And it was really a wonderful opportunity to continue to work with my mentors. Ultimately, after some time, I was establishing a practice and ran into some frustrations, and I was presented with a really awesome opportunity at the University of Maryland. So most oral pathologists practice in academic dentistry. It was kind of weird that I was one of the few that wasn't associated with the dental school other than some adjunct work at the beginning of my career. And so now I've transitioned fully into academia, still seeing patients and doing biopsies. But we moved to Maryland in January and adjusting to the suburbs.
The burb life.
The
That's where I met you, was in New York. That was my first time ever going to New York.
And you love New York, right? That was your favorite trip that you've ever been on.
I need a redo.
You had a lot of, I will admit, I love, even to this day, love New York. We have been going back about every 3 weekends. We've been going back up to see friends and to see shows. It's only about a 2.5 hour, 3 hour drive.
Oh, that's
But you had bad luck. You had bad luck on your first trip to New York.
It was like one of my first time traveling alone. I've gone to like East Coast places
I
before.
thought, didn't your husband, I thought your husband went with you because I thought I met him.
No. I was by
No. Oh,
myself. So I was traveling alone. I used to go to Florida a lot because that's where he did residency. So I was in Miami all the time. So I kind of got used to Miami. But that was my first time. And then everybody kept saying, like, New York is weird. Like, East Coasters can be direct. I really like directness. I'm like, oh, it's not going to bother me. But yeah, I had a bunch of odd experiences. So it's like, oh my gosh. So I was so glad I met you.
yeah. It's interesting because I've experienced quite a few different aspects of life, growing up in the Midwest and then living in New York. And it's interesting because in the Midwest, people are very nice, but they don't always tell you what they're thinking.
Mhm.
And in New York, people will tell you what they're thinking, whether or not you care to know or not. I remember one of my first trips on the subway. This young kid was asking me if the train went to a certain part of Brooklyn, and I had just moved to the area. And this older gentleman who was standing within earshot turned to his partner and said, "Why the hell would you get on a subway and not if you don't know where it's going?" I was like, he had a point, but he didn't necessarily need to vocalize that. But
Yeah.
the opposite, the flip side of that is when they say something nice, you know that they mean it. Like you earn your compliment. So
Yeah.
my patients, I would find, would be so unbelievably grateful that that what they're saying is true, and what their gratitude and the way that they are approaching your treatment is honest, and
Mhm.
that's really refreshing. That's really nice.
Yeah, it's not like a yeah, it's polite. It's not a fake nice. It's like they really truly mean it when they're giving you a compliment. They mean what
Yeah,
they say, right? And if whether you want to hear it or not, they're gonna say it. That's
but
awesome.
you definitely
Uh,
need a review.
what about the food?
Yeah. So the biggest, like the most difficult thing about moving away from the city has been the culture of a city. What's so great about being in a big city is that anything you want, you've got it.
Hmm.
The food is incredible. The thing is New York is such a competitive market for everything that if something isn't good, it's not going to survive.
Uh,
So I had probably in the 7 years I lived there, two bad meals the entire time I lived there. What's nice is we've kind of found a surrogate New York City in DC.
yeah.
So DC, it seems like it's a little slower pace, but still a lot of really great restaurants, a lot
Hmm.
of culture, a lot of history, and it's a little bit cleaner and a little bit less crowded. But New
It's so
York will always
clean.
have a special plate in my heart.
Yeah.
Yeah.
I need a redo. And I've gone to DC once. It was my first time also, and that it's so clean. I was like, oh my gosh, like this city is really, really clean. Also different, I mean, I'm a West Coast gal, so very different for me.
Yeah.
Yeah, the weather and all that, but I can complain about the weather all day. Nobody wants to hear about it. Um, so you knew that you wanted to do something, some type of specialty. How were you always like, I'm gonna do path. This is my heart, this is my passion, or were you thinking about other specialties?
So I didn't even know Path existed prior
Mhm.
to dental school. Uh, of course, I was the naive person going to dental school wanting to become an orthodontist until I took my first orthodontics class and absolutely hated it. Uh, Cheers to all the orthodontists out there. I'm glad that you do it, but I thought that it's something I would want to do. It absolutely is not. Forces and metals and how you move things.
Did it
No,
hurt your hand? Like, oh my god, my fingers. I was like,
we didn't have to
ouch.
do models. I know that that's
Yeah.
gonna like be really sad, but we did not do any models. It was all like didactic orthodontics. Yeah, so we didn't do the breaking down the models and the doing the treatment plan. So I got to kind of avoid that. I was the last class to make a gold crown, to cast a gold crown until they porcelain though. So I did do that, but I did not do the ortho models. But I I found that I was at a really bad at a crossroads,
Mhm.
probably maybe halfway through my probably first semester of my D2 year, which is the most brutal year of dental school at most dental schools. It's a very high, heavy, didactic period. And I was coming into dental school thinking of more from a medical diagnosis side. I was an anatomy TA in undergrad and really loved head and neck anatomy and was interested in head and neck structures and thought that dentistry would be more geared towards science. And while there is a very important scientific component, there is a huge aspect of creativity and of craft, working with your hands, that I thought that I would enjoy and didn't,
Hmm.
and struggled with. And I contemplated leaving dental school and applying to medical school.
Wow.
Yeah, I was about ready. I was researching MCAT classes when the Association of Women Dentists, I got to give them a shout out. They had a session during lunch, like a lunch and learn, where all of the program directors of all the specialty programs at Ohio State presented. And I was like, look, let me see what's out there and see if maybe there's a better fit, and then I can just stick it out and try to end up. And that's where I was introduced to pathology before I had even taken a pathology course,
Hmm.
and was set up with a mentor and did a lot of shadowing and was introduced to the profession that way because I didn't even know that it existed at that point of my career. And at that point I was determined to just stick it out and to get to oral pathology. And I enjoyed, once I got to clinic in dental school, I did enjoy the patient interactions,
Hmm.
but I didn't necessarily enjoy the procedures. I enjoyed just seeing patients and being able to interact with them. But I
Wow.
somehow made it through.
That's really mature, and that's you had a lot of insight and you knew yourself really well to know, like, I'm not happy. This is probably not for me. I can relate to that, but I didn't realize it until after, once I was already in perio, and then hindsight I was like, wow, I was really unhappy. Like, and I
With
love
with
my
general
general.
dentistry, right? Not
Mhm.
with perio.
No, I love perio.
Okay, good.
It's like
Good.
I'm so obsessed with perio. I truly love perio. I feel the same way. Like, I think that's why you and I connected so well, is I think we both love what we do so much and we work so close together. And it doesn't feel like work. It's so easy and it comes to me and it's natural and I like it, versus restorative. Not that I was bad. I was a lab technician for years, but I didn't have that fire for it, you know?
Yeah,
So,
totally.
mhm.
And I will give a little credit to periodontists. I do find that periodontists are probably the practitioners that I collaborate with the most
Mhm.
with patient care, with biopsies. I feel like periodontists are very attuned to oral mucosal diseases,
Mhm.
more so than most other specialties.
Mhm.
I think in oral surgery, we work a lot with oral surgeons, but a lot of their focus is on certain procedures.
Mhm.
They've got to do implants, they've got to do wisdom teeth removal, they've got to do a wide variety, surgical assisted palatal expansion. A lot of it is procedure based, and that's a little true for perio too. But perio, the procedures are addressing mucosal disease.
Mhm.
We also work a lot with endo, but endo is working on usually one specific type of disease. But I
Mhm.
find that there's a lot of overlap between periodontists and the focus on managing mucosal disease and what I do clinically and under the microscope.
It's so fun. We've had some really fun cases. And then when you start to throw in all the systemic links with perio and other things and all the oral manifestations of systemic disease, I love oral path, as you know. Like, it's so fascinating to me and it's just so awesome. But you really get to feel like I'm helping the patient as a whole, like systemically. It's so rewarding. So yeah, you and I have worked together for 3 years now, 4 years.
Um, we were 2021, right? Because we were first ones after pandemic, I think,
Yeah,
right?
we did 40 under 40, and it was the first class after,
I think
well, it
so.
was
I think
still
it was
pandemic
2020.
because I got COVID during that trip.
Oh, that also ruins a New York trip too.
Yeah.
Uh, it was in 2022, September 2022. So we're coming up on 3 years.
3 years. Yeah. So
That's
actually,
wild.
as long as I've had this startup, then we've been working together from the beginning, which is super awesome. Let's talk about that too, because I love working with you because we have such a good communication and collaboration. And before that, I just didn't have that with pathologists. Like, I feel like you truly care about your patients, and it's not just like you give me the pathology report, we're hopping on the phone, we're discussing long term, because it's not just we biopsy and we're done. I still see the patients, and we're still trying to work with then their physicians or other specialists, so we're all collaborating together. I didn't have that, and maybe that was just me and I couldn't find somebody, but when you and I started working together, I really felt like we're a team, even though we're across the country literally from each other. So let's talk about that. And how did you develop that to have that kind of working relationship with your doctors?
Yeah, so I think that what you're saying about teamwork is the future of medicine. The Both the blessing and the curse of the day and age that we're living just in medicine in general is the fact that everything is becoming super subspecialized, which is great. We have people now that know way more about specific things than people have ever known about that in the past.
Mm-hmm.
But because of that, the team has expanded. So what a patient needs has gotten bigger.
Mm-hmm.
And you want everyone to be on the same page. And the only way to do that is through open communication. The other thing, too, is I think that my personal opinion and the way that I was trained, I had really excellent mentors, is that we are a consulting service. And the idea of pathology is to be able to help your clinicians guide their patients to appropriate treatment. So I think it's a little disservice both to clinicians and to patients if, like you said, all you do is send out a pathology report. That while it does answer the question and there is a degree of clinical pathologic correlation, I think that we have a responsibility both to our team and to the patient to be accessible and to be able to answer. And if something's weird, I will call a clinician and be like, hey, I want to give you a heads up. You're getting a weird pathology report. This is what I see. This is what I'm thinking. Which also kind of leads back to, I think that having clinical background is also extremely helpful to what I see under the microscope, because I have a feel for what would I do if I was this clinician, because I've seen patients like this before.
Yeah.
And I think that's becoming more and more of a necessity, is that you need to have some sort of idea of how to guide people what to do. I think it's a disservice to let them kind of stumble around the dark.
Yeah, you're so good at that. I take a lot of photos, and I'm like, I'll email, and then sometimes I forget, and you're like, hey, email that photo.
No,
So
which we love. The photos are excellent, both from an educational
yeah.
standpoint, but also because it's so helpful. We're seeing. I was speaking with a pathology assistant earlier today, and a microscope slide is only one small part of the clinical lesion. When you do a biopsy, it's not like we're seeing everything all at once. And so to have the context of an x-ray or a picture is so helpful
Mhm.
in creating a clinical pathologic correlation.
Can we talk about histo for a bit? So I love oral path, but because I have the photo and because I have the information and because I'm clinically seeing the patient, and it's a puzzle piece, right? And we're trying to get it together. And I hope nobody's like from the board is listening to me, but they perio, we have to know certain pathologies because there's a lot of oral manifestations of other systemic links that are linked to perio. A lot of the inflammatory markers are the same, so there's just certain things that it's just part of our routine. And so they part of our board exam is we are shown a histology slide and we have to break it down. And I'm not colorblind, like I can see, but sometimes I'm like, what am I looking at? And I remember the case and I'm like, I think it's this. And I knew words and I'm like, I think I'm seeing some, I didn't see it. I didn't know what I was looking at. So how did you develop that skill? Because I think histo is so hard. I used to have histo slides at my old place in Loma Linda. And some histo, you just kind of see some things, like you see a little heart or something. So I literally had like a implant histo as decoration, a little heart. It was probably like urinary tract lining cells,
Yeah.
like, but it doesn't. I don't know what I'm looking at. How did you develop that skill?
So that's the most kind of jarring part about the residency experience is you've just spent 4 years trying to perfect a craft and you've become a doctor.
Mm-hmm.
And then you walk into residency and you essentially start from scratch.
Mm-hmm.
I mean, you have most people going to oral pathology residency have some sort of exposure just to make sure that that's what they wanted to do and they had an interest. But it really is learning an entirely new language. The nice thing is most residencies, the focus is on just repetition. And most residencies, all residencies really have a huge treasure trove of pathologic slides from old cases to review.
Mm-hmm.
It really is just repetition and pattern recognition and seeing it over and over again. The nice thing is that within 6 months, you already have kind of perfected 90% of what you see. 90% of what you see is fibroma, periapical granuloma and cyst, and dentigerous cyst.
Mm-hmm.
The other 10% is what you spend 2.5 years learning. So you kind of get your feet wet and it moves pretty quickly for most people that within this first 6 months or so, you've got a good grasp of the basics and a little beyond. But then the next 2.5 years are spent perfecting the rest of
Nice.
that knowledge. And even beyond that, I'm still, that's what the whole point of continuing education is, even for oral pathologists, is I got to know what's new. I got to know new developments and I got to get refresh stuff that I haven't thought about or seen in a long time. So that's why we're always learning.
I know. I feel like I probably keep you on your toes a lot because I get those like unicorn cases, and I'm like, but Steven, like it's like the testosterone's high. This doesn't make sense. Da, da, da. And then like we get to collaborate, and it's so fun. Now that you're in academia, you made a shift from private practice to academia. How's that transition? You're really good at coaching and mentoring, but now you're working with residents as well, right? So how has that been?
So private practice-ish. I was more in a hospital setting, so it
Mm-hmm.
wasn't necessarily private practice, and that had a residency program too.
Mm-hmm.
So right now the transition has not been all that strange because I'm still working with residents. I'm still doing that. What's uh, interesting about the transition is I am focusing on growth of this new place. At my previous position, one of my favorite things was doing surgical pathology, cancer resections.
Mm-hmm.
And there's an opportunity to do that here as well, but it's going to require a little bit of legwork. And so that's been a lot of my focus. I will probably start pre-doctorate teaching in the fall. Right now, I'm teaching both the oral pathology residents on a daily basis, but then the post-grad residents probably once or twice a week, either with case-based learning or even at the microscope, like you said. I've been doing a lot of the endo and perio residents on Friday afternoon with histology slides, and I try to make it relevant as opposed to more obscure stuff that they'll actually see and want to know. But I did a little bit of pre-doctorate teaching at Toro when I was just starting my career, and it was kind of part-time at the hospital and part-time at the dental school, and that was a really good foundation. The one thing that I'll say is that I've been really fortunate in oral pathology to have all the mentors I have, from Ohio State to my mentor at Toro, who was a graduate from the same program that I did, and then both my program directors and uh, colleagues after when I was working with them. They All of these people have shaped the way that I deliver care and the way that I practice. So I've been very, very fortunate. And now that I'm stepping into more of stepping out of the nest and working as a collaborator rather than someone that's a mentee role, I'm able to kind of use what they've taught me to practice the way that I want to practice and to help to expand the care that I'm able to deliver.
Yeah, that's beautiful. I feel you. Mentors are so important. It's so important. We wouldn't be where we are without our mentors and mentorship. So, do you have any mentees that are coming in and interested in oral path? I can't think of any of my classmates that went into pathology. Not yet. I feel like you guys are so. Do you know how many pathology? Yeah,
Between 250 to 300.
yeah.
And it depends on if you're including people that are retired that have emeritus status, or it's a very, very, very small. Um, so it's very, what I have learned about professional mentorship. So in undergrad, I was very interested, and even a little bit in dental school, in leadership development.
Mhm.
And you kind of establish, oh, you're my mentor, I'm your mentee, and you have kind of a formal structure. In practice, I it's very interesting because I don't necessarily see myself as a mentor,
Mhm.
but I've had people come up to, and I don't mean to toot my own horn, but I'm sure you experience this too. I've had people come up to me that either former residents or people that I've never even met before that have learned something from social media that have told me that they've learned so much from me, either from direct teaching. I've had previous dental students reach out to me and say that I learned so much from you as a professor. I've had previous residents. I've had random people at meetings that are I've never met in person before that I've seen my online stuff. It's very interesting because I think that we can all make an impact and not realize it. And I think a lot of my impact is just you treat people the way that they want to be treated. You practice the way that you would want people to practice for you and your family. And hopefully that resonates with people. And I'm sure you experience that too because your social media presence is so great, and the way that you elevate people to speak, especially with your scrubs and scalpels and your women in perio. And I think that
Yes.
that's really incredible that you're able to do that too.
Thank you. I gotta get you on a CE for scrubs and scalpels. I really love Path. Like it is just it's so awesome. I love doing biopsies. I love sending it in the mail. It's just it's so fun. We gotta get you on scrubs and scalpels. Before we close up, let's talk about your YouTube channel. So you really inspired me to start on YouTube. When I met you, you've been YouTubing for years now, for a really, really long time. And you have one of my favorite dentists, Morton. Love him. I since before he's grown so much. But even back in the day, and he and I would chat, and he's like, "Hey, what membrane are you like?" Blah blah blah. Because a lot of the research, as we know, it starts from animal research, but he's doing a lot of good and really awesome cases. But you have a really really cool YouTube channel. So how did it start? What was the thought process? And tell us a little bit about that so that the audience can go find you and follow you on there.
Yeah, sure. So a few things that you've mentioned. Um, Today, actually, I got an email from YouTube. Today, May 10th, the day that we're filming this, is my fourth anniversary of YouTube. They
Yay!
actually sent me an email, and I didn't realize it. So the way that kind of started, um, one of the people that I consider a mentor is a huge force in social media and in CE speaking, Dr. Ashley Briotti, who's Central Ohio Oral Pathology on
Mm-hmm.
Instagram. And she was actually in her chief year of residency the year that I was a fourth year dental student. So at Ohio State. So we knew each
Wow.
other in training too. And what does on Instagram is really awesome. I think that she provides a lot of value on Instagram. And uh, I saw an opportunity because in Instagram, you're limited by pictures and what you can put in a caption.
Mm-hmm.
Whereas I feel like my strength is in speaking and connecting, which is why I love giving CE. I want to give more CE. CE is my favorite thing to do out of
We gotta
anything.
get you to
Lecturing,
San Diego. Have you guys been to
loves.
San Diego?
I went to San Diego as a child. I went to the safari park as a child, but I need to go.
You're
I need to
coming
go.
back. You're
Absolutely.
coming back, and
Perfect.
then you're not going back to DC. You're gonna be like, I'm
Perfect.
moving. Like, we're moving again.
So we'll see. Hot heat in me, we'll see. But I saw this opportunity because I felt like my strength in being able to communicate things. I've always been kind of a performer where I did the theater thing growing up. I was a tour guide at Ohio State. I was a TA as an undergrad. And I've always been very interested in education and speaking and connecting with people.
Were you in a
And
frat?
yes, yeah, I was,
Yeah, there we go.
yeah, SIGEP.
There you go. I was a Delta
Yeah,
Zeta. Yep.
yeah. So I did a lot of leadership through that too, and I saw a potential need. The weird thing about social media is that sometimes it feels like you're screaming into the void, and you don't know if you're providing value or
Right.
if anyone really cares. So I put it out there and did things both that I thought people needed to learn about, but also things that were interesting to me. That it's kind of fun to do. I've done the meaningful. You got to do stuff that provides value, but also I did an interview of the guy that voices, not really an interview, I got a cameo of the guy that does the Animaniac voices that had oral throat cancer, he had HPV throat cancer.
Oh.
So being able to hear his thoughts, like it's stuff that I think is cool in addition to stuff that I think is important.
Mhm.
And I think that that's something that is unique to this format. And I've been very fortunate that I've kind of found my space there. Interesting thing about Morton, who's a awesome guy.
Mhm.
We went to Denmark and Norway for New Year's,
Mhm.
and he and his family, he's Danish, but they happened to be visiting Copenhagen as well. So my wife and I were able to get dinner with him and his family,
Wow,
and
he is
it
so
was
nice.
such a gracious guy. He and his
Yeah,
his whole family, so gracious and so nice. It was a really lovely to be able to finally like meet him in person after having that YouTube thing
he's
come to a conclusion.
hilarious. Yeah, he's such a nice guy. And my husband likes following him too, because then he's also doing the anesthesia, so the little animals are like papoosed on there.
Doing their CBCT with the on their when they're laying flat and the
Like the creativity, right? But that's what's awesome is we can like all connect and collaborate, and like we're all in different fields, but at the end of the day, like it's the same. And I think our core is the same. What we're looking for is like the same, the collaboration, the friendship, and the mentorship or providing, hopefully knowledge to some people. Maybe we're talking into the void.
But I
Okay,
think
what?
that's what's so important with people that are specialists. Going back to what I talked about before with kind of the medical team has become bigger and the
Mhm.
knowledge has become also less manageable for one person, which is why you need super specialists or
Yes.
subspecialists. And I think that especially in a specialty where the information is relatively limited and the expertise is limited, there's only 250 of us,
Mhm.
that I think that there's also a little bit of an obligation to do outreach, educational outreach. And so part of my hope is to provide information to patients and providers that isn't readily accessible based on my experience as a specialist. And granted, again, I don't want to tout that I'm the most knowledgeable oral pathologist that ever was, but I do think that I have knowledge and value that could be meaningful. And so I think that as someone that has knowledge that isn't readily available, it's important for me to make that presentable in an effective way. And I hope that my YouTube does that. I've gotten some good feedback, so
Oh,
hopefully
you have
that
a great
continues.
channel. You have a really good channel. This is like totally off the wall, but I had a thought. In private practice in dentistry, it seems like the pendulum is going to definitely swing in the DSO or big group, whether you call it an independent DSO, they're privately owned or owned by equity. The pendulum's going to shift in that direction versus like an office like mine, where it's owned by me, it's ran by me, and those privately owned offices. But if there's only about, let's say, 200 pathologists in the US, DSOs tend to keep everything in house. That's their model and that's their idea. So, do you work with a lot of DSOs or are they sending locally? Because I know in my area in San Diego, the pathologists that are at the hospital, they will not accept your sample or your pathology sample unless it's taken at the hospital. I can get hospital privileges. I know. It's don't get me. I have horror stories. I literally had one of the pathologists. This is when you were in your transition, and they sent it back to me via the courier. I was livid. And listen, I work with the physicians a lot. Like I work with the nurses a lot. So they sent the sample back via the
What a
courier, and
shame.
I was just like, oh my gosh, like it was a whole thing. But I finally had a conversation because then I had another patient who had a different insurance, and they wanted it to be one of their doctors to sample, and I'm like, there's nothing else to sample. I excised. Like, what do you want me to do? So like we're dropping the ball on patient care in that sense. And like again, for me, one of my close friends here, she's a surgical oncologist at one of the teaching hospitals. So I what you guys do is really, really stressful, especially when we're dealing with cancer cases and cancer patients. And it can be really, really stressful. But going back to the DSO thing, are they going to be able to find somebody that sees for all of their patients, or what do you think is going to happen with patient care when we do shift in that direction more?
That's a great question. So there's lots of possibilities.
Mm-hmm.
I know that my previous institution, there was a smaller regional DSO,
Mm-hmm.
and all of their offices sent their biopsies to that institution.
Yeah.
And so I think the one thing that I will credit DSOs, I don't have a horse in the race here, but the one thing that I will credit them is that they do a lot of risk mitigation. And with risk mitigation, they do support both oral radiology and oral pathology. They recognize if we're going to have someone read this biopsy report, we want it to be someone that knows the structure,
Mm-hmm.
someone that is really knowledgeable. And there are great medical pathologists, great head and neck pathologists, but sometimes in more regional hospitals, it's people that may not have as much exposure to head and neck pathology and they might miss a diagnosis. So I think a lot of DSOs do recognize value in specialists,
Mm-hmm.
especially in oral pathology, oral radiology. So the one path is subcontracting, which is what I'm seeing a lot of, to be honest.
Mm-hmm.
The idea of, okay, you're going to be our exclusive provider. We're going to send all of our biopsies to you. The other is what you're saying in-house. How do we hire an oral pathologist that is our oral pathologist in-house? What's going to be very interesting is we in pathology are shifting more towards digital pathology, which means rather than reading something from a glass slide, that glass slide is scanned and then we read the slide on our computer, which means even easier regional pathology. And I think that that's going to play a big role in the way that medicine is heading, especially in dentistry too, and the idea of DSOs. The interesting thing is patience. And I tell everyone that if they want to start a clinical oral pathology practice, they can go anywhere in the country, open a sign, and they're going to be busy within 6 months. So I think, again, it's that I think that a lot of DSOs for these rare stuff, they have their own autonomy to send
Mm-hmm.
out, but there's also an opportunity to be that person. I think you'd have to do a lot of traveling around to different
Yeah.
offices, but I think that that's also an opportunity for oral pathologists to be hired by these larger groups. And some are. I know some oral pathologists that they got hired by oral surgery or periodontal groups that are large group practices, and they're their go-to clinical person.
Yeah, that makes sense. You guys are busy. Do you think with digitizing everything, AI is going to come into play? I use it a lot when it comes to radiology because I'm using a 3D on honestly almost every patient, and the times I haven't, I highly regret it. So, do you think that's going to come into play and just help you with your diagnosis and what you're looking at using the software that's coming out?
Yeah, so a few things. First, a little shout out to one of the people in my department here in Maryland. His name's Dr. Ahmed Sultan. He's awesome. He is originally from Egypt but trained in Ireland, so he's got this really awesome Irish brogue. But all of his research is focused on AI and pathology. And what he's doing with AI and genes and identifying genes and patterns using AI is absolutely incredible. Whenever I hear him or his residents or his postdocs talk about the research that they're doing, it just kind of blows my mind a little bit. What I will say is, I think AI will become a tool.
Mhm.
I did a whole video on my thoughts on AI on YouTube that's now already outdated. I did it like a year ago, and now we've already progressed beyond that.
Wow.
I think that AI will be a tool, but at the end of the day, the practitioner is responsible. So the thing is yes, we can have AI render a diagnosis, but you want a human being to verify,
Hmm.
or you can use AI tools to help with your diagnosis.
Hmm.
So there are AI systems that identify perineural invasion in cancer, which is an important prognostic factor as well as treatment indicator for radiation. There is are AI models that will try to figure out how deep a cancer is. And so I think that AI will help things be more efficient and more accurate. But I think it's important that rather than seeing it as a replacement, we see it as a tool. Same thing with like CBCT is like if you get a CBCT reading from AI, you're still ultimately obligated to make sure that that's
Hmm.
accurate and that it didn't miss anything. So you still want to make sure that you're reading, and I know that you would. I know that you would, knowing your level of detail, but knowing that that is a danger for people that aren't as diligent, that are going to start relying on these AI models, and AI models are not perfect. And so if they miss something or if they misdiagnose something, then you, the human being, is on the hook. So I think AI will be a great tool and I think it's going to make things better, but I think we have to frame it as a tool where we
Yeah,
use it to help and not use it to rely on.
I agree 1000%. I'm really excited about it, and I'm totally on your page. I'm not of the thought where people are like, it's gonna take our jobs. I'm like, no, you just have to figure out the tools and you be that person to learn how to use it, because this can ultimately help us as a good tool. Okay, so before we close up, I want to know one random fun fact that people don't know. I actually didn't know that you did theater. You might have told me.
Oh.
So something that people don't know about you that has nothing to do with pathology.
So many random things. I'm a hobbyist.
Uh huh.
So I like I have so many different things that I'm interested in and I get super hyper fixated and then I move on. Like my sister has made it her goal to every ballpark in the United States, and now I've kind of adopted that. I've kind of made it my goal to every country in the world. So I have a lot of weird, strange interests. Theater, I see a lot of theater, but one interesting fun fact, let's see. I've been above we when we went to Denmark and Norway, what we went above the Arctic Circle. That was
Uh-huh.
pretty cool. I once ziplined from Israel to Jordan from one country to another. That was pretty cool.
Wow.
I'm thinking of weird travel stuff. That's like what's coming to mind for my fun
You're
facts.
random
As a
fact.
kid, I did I oh here's a embarrassing self-deprecating one. As a kid, I did Taekwondo
Uh-huh.
until I was a red belt, and I had to quit because at red, that's when you start sparring,
Mhm.
and my strong gag reflex didn't allow me to wear the mouth guard. So I couldn't wear the mouth guard, so I couldn't spar because I would gag every time I wore the mouth guard.
Ah, you
Dental
should.
school is awful with the strong gag reflex and doing impressions, and I always had it circled on my calendar. And in the last semester that we had to do it on each other, the instructor knew me well enough by then. She walked over and quietly said, "We don't have to do it on him."
Yeah, that's a good fact. Ooh, and like
Oh
it's
my
not even in
gosh!
your mouth, like it's on the counter. So yeah, I
It's the
get.
anticipatory.
I'm like, yeah. Don't encourage this. Okay, so we got to get you to. Have you been to the Padres Stadium? No.
No,
No, you guys are coming to
no.
San Diego. I would love to have you out for CE out here. And we are going to a Padres game. Who's your team?
So, growing up in Cleveland, you don't have a professional sports team because they're all awful. The back then in the Indians, they were called the Indians in 1996. That was the one year that they were good. The Guardians have been good since the rebrand. They've gone into the playoffs, but I don't really have a team, and I'm not like a super baseball fanatic. Like I don't necessarily know all the players, but just going to a game and being there and having the food and watching the game happen is so fun. I think it's so fun. More fun than any other professional sports. Like I don't enjoy NFL games. I don't enjoy NHL. No
Basketball?
shame on those. Like NBA, I'm not
No.
a big NBA person,
That's
but going to a baseball game is just it's just fun.
It
I don't
is
know.
fun. We got all the sports teams. Our soccer team's really good. We just got a men's soccer team. Our women's is awesome. Those games are really fun.
I
But
will say soccer.
Padres,
I do like soccer too.
yeah,
Soccer and baseball.
we got two soccer teams, men's and women now. But Padres game in San Diego, we have the best fans. It is so awesome. We have a really good team. We didn't quite. We lost to the
Oh,
Dodgers.
you went to the semifinals last year, I think,
Yeah,
right?
we
You went
lost to
really
the
far last
Dodgers,
year.
unfortunately, but they're
Yeah.
doing pretty good this year. We got some good players. We got some long term players that have been with the team for a long time. But we got to go to a Padres game. It's so fun. I love the food. I love the hot dogs. I love the beer. Like the atmosphere is just so good. So that we got to get you to San Diego, and you can see the water. It's just beautiful. It's so beautiful out here. So I can't wait to have you out here. Thank you for being my first guest. I appreciate it so,
Yeah,
so, so much.
huge honor. I
Yes.
appreciate it.
Yes. Thank you. Okay, I'm going to stop the thing.